Hello, I'm Dr. Tess Mauricio. We should all be beautiful inside and out.
The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. When it comes to beauty, they say she's the best. But who is this woman they call Dr. Tess in your world? The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show. The Dr. Tess Show.
This is the Dr. Tess Show.
Ako po si Ann Esteban. Pamangkin ko si Dr. Tess and her mom is my first cousin.
My Auntie Annie, she is one of my mom's favorite cousins. You know, she's a lot younger than my mom, but unfortunately in her late 40s, she developed severe rheumatoid arthritis to a point where it's really debilitating. She can barely walk, she couldn't sit.
Noon pa, hirap na akong yung may brush my teeth, yung comb ng hair, yung ganun. Kahit na sa bathroom, hirap akong maligo. Minsan yung asawa ko, inalalayan niya ako. Tapos sa pagtulog sa gabi, hirap kong i-pull out yung aking bedsheet. Sa aking paglalagay, I'm always limping.
She had pain everywhere, and it was really affecting her life.
Almost every night, umiiyak ako sa sarili ko dahil matindi yung kirot, parang wala na akong magawa. Tapos naisip ko pa yung ibang bagay na parang gusto ko nang tapusin yung ko dahil talagang masakit, mahirap, matindi ang sakit. Hindi mo maintindihan kahit na nagagamot na ako ng mga Tylenol with codeine, wala pa rin. Kaya ay talagang parang lose hope na ako.
So my mom actually talked to her during the conversation on the phone and said, you know, you should come down to San Diego and talk to Tess about the regenerative stem cell therapy that she does. And we can't make a promise, but you know, you're too young to be living in this much pain. And so I finally saw her and I was really shocked because she could barely go from sitting to standing or vice versa. And this is so devastating, and her husband has to always be around her just to kind of support her. And she's tried everything. She's seen her rheumatologist, she's done the shots, the steroids, everything that is medically available. So I said, you know, Auntie Annie, let's just do it. You know, what's the downside? Regenerative stem cell therapy is really a simple procedure where I will harvest, you know, your stem cells using your own fat cells. It's done under local anesthesia, and we did that for her. It's very simple. She loved the fact that it also reduced the fat on her belly, so it made her skinnier, and she totally tolerated the procedure. We processed the fat down to the regenerative stem cells, and on the same day we introduce it back to the joints that hurt, and also we give it IV so that the stem cells can travel around her body and look for the areas that are diseased and inflamed, and it was like a miracle for her.
Hindi naman masakit. And then after 2 months, magaling na ako. And then until now.
Her pain has diminished so much. Now she's almost 1 year out from her procedure, and her pain went from 10 to 10 to 1 to 10. She doesn't take any more medication.
Pwede na akong mag-garden kasi noon sabi ng rheumatologist ko, don't do gardening, never. You have to let somebody do it for you. Sabi nga sa akin. Pero after that, ginawa ko na yung gardening. After 2 months, galit na galit sa akin yung asawa ko dahil sabi niya, oh, inaabuso mo naman yung sarili mo. Sabi gano'n sa akin po. But I love gardening talaga.
She's back, she's going to Vegas, Sacramento, traveling. She's gone on trips with my parents.
Yeah, lahat nagagawa ko na. Lahat, kahit na sewing, crocheting, yung mga ganun ba. Saka nakakapag-casino na rin. Kasi ba?
She's back in the casino, walking around without pain. I mean, it's to a point where she even, you know, now is thinking about the O shot because she's feeling so good with her life and her relationship. So, I mean, I'm just so happy that I'm able to provide this type of, you know, technology and care to my mom's favorite cousin because they are now having such a great time together.
Oh, salamat Dr. Tess sa ginawa ninyo sa akin. My life changed really a lot. Yeah. Thank you.
You know what I don't understand? Women take care of their husbands, their kids, their jobs. Pero pagdating sa sarili nila, bakit wala? Bakit kaya? Showbiz is a lot like real life. If you take care of yourself, people will respect you. And you know what? If you're happier, mas masarap kang kasama.
You can look and feel beautiful at any age when you take care of your face and body. We use the latest technology to make you look 10 to 20 years younger without surgery, without the fake look.
So ladies, kahit na gaano kayo kabisi sa ginagawa ninyo, huwag niyong kakalimutan ang sarili ninyo. Take care of yourself because trust me, you're worth it and you deserve it. So go to the best, Dr. Tess, America's favorite dermatologist. I did, and I'm happy. Mukha ba?
So ladies, when you're ready to take care of yourself, we're here for you. Tama ba, Gabby?
Sure, Dr. Tess.
With M Beauty by Dr. Tess.
We all have issues with our face and skin at any age. Now stem cell technology can help. Introducing Lifeline, stem cell in a bottle.
I found the most amazing technology. This is human stem cell technology, but these stem cells are not embryonic.
Sabi nila bumata daw ako. Tsaka nawala yung mga wrinkles, tapos nag-glow yung face ko.
Skin becomes brighter and clearer just after a few days.
Buy one, get one free at mbeautyclinic.com. Hurry while supplies last.
My name is Lisa Castillo, and I'm the personal executive assistant to Dr. Tess Mauricio.
Well, Lisa has been part of our family, extended family, for forever, it seems like. You know, we've known each other since she was a teenager. She's known me since I was in college.
I've known Lisa since I was a kid, and a lot of people don't know this, but we're actually roommates right now. So it's so much fun. We're like sisters. We, you know, hang out together. We work together, and it's really a great relationship. She's very easy to get along with, and I mean, really, the best way to sum up our relationship is it's like she's my sister.
No one really knows, besides close family and friends, that I am hearing impaired. And one of the biggest misconceptions that I always get is everybody thinks I'm mean.
I never noticed Lisa was hard of hearing when I was younger, but as I got older, I think her hearing loss became more profound, and it became harder to even have a conversation with her.
She basically has managed over the years to just kind of, you know, go about her daily activities with partial hearing, which I can't even imagine.
I would have to tell patients or new people that I meet that, by the way, I'm not mean, just you can yell at me, because they always think I'm ignoring them. I'm not mean, promise.
You know, I feel scared for her as well, just as far as her safety. If she's walking, she can't hear someone coming up behind her, or, you know, let's say if someone's maybe trying to call to get her attention, she can't hear them.
I mean, sometimes, you know, when I'm flying and then my ear doesn't decompress, my ears don't decompress, I mean, I can't even imagine living life in a kind of a fog like that. And so, I mean, when we had the ability to give to Lisa the gift of hearing, and now obviously after so many years, technology has improved so much as well. I'm like, yes, let's do this. When Angela told me, there's an audiologist, that we can work with, and he can provide Lisa the latest technology in, hearing aids, then, would you like to do it? I said, yes. Yes, definitely for Lisa.
About a year ago, I was contemplating getting hearing aids again, and I went into Costco to get the hearing test and find out how much they were. They're pretty pricey compared to technology 10 years ago when I had my first set. They've gone up a lot, but also they're better now. But they're still expensive. They're still expensive, so I debated and I just kind of sat on it. So it was quite a surprise when Angela told me that it was going to be a present from Dr. Tess.
So the day of the appointment, it was very elaborate. So I had to separately tell and text my family, hey guys, please don't ask Lisa to do anything. Don't tell her to go into work because I have to take her to the appointment. And I had to make sure Lisa didn't wear sweats or didn't, I wanted to make sure she did her hair and did her makeup. So I was texting her daughter, Amara. I'm like, how am I gonna make her get ready without, spilling the beans to her? And so I did her makeup telling her, hey, I've got this new technique that, I learned on YouTube, contouring. You gotta do your eyeshadow this way. Let's make your eyebrows a little bit darker. And so by the end of that, she was all done up, full makeup, her hair was done. And to get her to come with me, I told her that I secretly got in touch with the jeweler to change something about my engagement ring. And, I was saying, don't tell Austin, don't tell anyone, I don't want to offend him.
And I actually said, are you sure about that? I don't know if you want to do that. Have you told Austin about this? She goes, no, it's fine, it's fine.
But just come with me to the appointment. And she's like, okay, I'll go with you, right? She's so doting, so she came with me.
And we're driving, and I'm thinking, where are we going? This does not look like, this is like shiesty for a place that's for a jeweler.
We walk in, and it looks like a medical office. So she was like, Ange, this place is shady. Are you sure you researched this person? We walk in the hall.
I saw the sign that said hearing aids. It didn't click right away, and I thought in my head, this is kind of shiesty that this guy is a hearing aid specialist and a jeweler? That's weird.
So we walk in, the audiologist is there, and he's introduces himself, and then I'm telling Lisa, this is for you. She looked kind of dumbfounded for 5 minutes, so I'm like, does she really realize what's happening?
So Ash goes, surprise, this is for you. It still didn't hit me, because anyway, it still didn't hit me, and I'm thinking, you're still gonna do your ring? So anyways, and she just sat down and said that, oh, by the way, we are going to take care of your hearing aids for you.
And I don't think she really understood what was going on until she sat down. Dr. Flowers was in front of her, telling her exactly what was going to happen. We're going to get her fitted for a hearing aid, and we're going to give it to her as a gift so she doesn't have to pay for it. It's going to be from us. So it was a good surprise.
She called me right away, and she was crying, and we were crying, and
I feel like I'm a little bit more confident now. And like I said, where people mistake that I'm mean, I'm not. I'm just really shy because I can't hear. And you can't really participate in life when you can't hear what's going on. So.
Ang sikreto ko ho, exercise, syempre. Diet, of course, importante yun. At maraming tulog. At ang pinakasikreto ko sa lahat.
Hi, Gabby!
Dr. Tess!
Sorry, late ako
Okay lang, alam ko busy ka.
Okay, prepare ka na ha?
Okay. Gotta go. Dr. Tess Mauricio, America's favorite dermatologist. Yan ang sikreto.
So now, you ready for your next time machine?
Ready, Doc?
Let's start na.
Let's go!
And Beauty by Dr. Tess.
In
my trade, people go to great lengths to look younger and more beautiful. I believe you can retain, enhance, and even turn back the clock without going under the knife. There is no need for a facelift, a brow lift, or eyelid surgery. The Time Machine uses the latest technology to make you look 10 to 20 years younger without surgery, so you always look natural. You should try Dr. Tess's Time Machine. I did, and I couldn't be happier.
In this business, your face is your #1 asset. It's the canvas for all your emotions. How's that for drama?
Hilda Cornell has one of the most beautiful faces in international cinema.
So you want to be sure your face is well taken care of. So I go to the best. I go to Dr. Tess.
We customize our treatments to your individual needs. Our Time Machine program can make you look 10 years younger in a natural way. It's super high-tech and very economical.
Dr. Tess, simply the best.
Hi, Daniel. Nice to see you again.
Hi,
Good to see you again. Are you ready for this today?
Yes.
This is going to be very, very exciting. Very, very life-changing for you since you've had this hearing loss for such a long time. Are you ready to go?
Yes.
Let's get to it. My name is Daniel Flower. I'm an audiologist in private practice for 30 years this month, and that was prior to working at Children's Hospital for about 3 years.
I'm not one to ask for things. I never ask for anything, you know. Being a single parent, I always give everything to my daughter, and I thought, okay, eventually I'll get hearing aids, but I want to give everything to her first. And I thought that, you know, I'm getting by anyways. I'm getting by. Even my old name tag said hearing impaired. It's clear. It's super clear.
It was a very emotional moment. It was very touching because, you know, everyone takes their 5 senses for granted, and for her, I literally saw like a period where it was given to her, and it was amazing. I'll never forget it.
And I wasn't there, but you know, she called me right away, and she was crying, and we were crying, and it's just so emotional because, you know, it's like hearing. It's so important, and she loves music.
I'm still trying to get used to hearing my voice.
Right.
And we're looking at these different frequencies of the hearing loss and determining how much amplification or volume we're going to put in there for soft sound, for loud sound, and the maximum sound that the hearing aid is going to put out.
So the first day that I put in the hearing aids, the first thing I noticed was Angela was texting her sister, and I turned around. I said, "Your phone has sounds?" And she starts laughing. She goes, "Yeah, my sister's is worse."
She told me like that for the first time I was able to, like, you know, listen to the radio. I mean, I can really hear music. I can hear when people talk to me without having to, like, you know, look at their mouths because she was lip reading.
It's funny because I can tell when she doesn't have her hearing aids on when she's around the house, because she's slamming doors, slamming cabinets, she drops things. Like, you know exactly where Lisa is in the house because she's making noise. And then when she has her hearing aids on, you know, I think she's a little bit more cautious about how things sound, right?
Just knowing that they know how much it has affected my quality of life, and knowing that they were all on board for this, I was really shocked because I don't think not many people know how difficult it is to go through life feeling this way because you really don't interact. I would shy away from social situations. I'd shy away from conversations. I just can't catch everything that's being said. I would grasp just the gist of the conversation and I'd politely smile, but I never really could engage in conversation with people. And that's why people think I'm mean.
So she really was dealing with this day to day, minute to minute. Every single interaction she was having with someone, it was affecting her.
One of those aha moments that I had was so odd. It was pouring orange juice. And I poured the orange juice and I was like, oh, that sound of water.
You know, even like a faint motorcycle revving in the background, like she can hear it now, when before I was like standing right in front of her and she couldn't even hear me.
But even the first night that I got the hearing aids, Ange says, okay, we're gonna test this. Let's watch a comedian without closed captions. I said, that's pretty ambitious. So she turns off the captions and I started crying again because I could finally know what laughing out loud really means, because I could see the expression of the comedian. I could get the punchline. I could understand everything, the movements of how they're supposed to be funny.
And I'm just so happy that, that we're able to really give that to Lisa, and she really deserves it. And I know that she'll just enjoy it. And because, again, she loves concerts, and we're gonna be like rocking the next concert, and she's gonna hear everything.
It's life-changing. It's definitely life-changing. I feel like a little bit more confident now. And like I said, more people mistake that I'm mean. I'm not. I'm just really shy because I can't hear. And you can't really participate in life when you can't hear what's going on. So people make fun of me that I really I crank up the bass in my car, but that's how I sense music, because I can't hear the music, but I feel the music. So I wanted to say to Dr. Tess, Dr. James, Angela for setting everything up, but also the entire Mauricio family for being supportive of me, knowing that my role is so important here, that you've also cared enough to help me. I'm always the brunt of jokes, but thank you for always laughing with me and not just at me. But from the bottom of my heart, you guys are the greatest, and I'm so blessed every single day knowing that I work for an amazing boss and an amazing person, just bottom line. Thank you.
I'm so blessed to have a successful career in show business and be a wife and a mother at the same time. After my second child, napansin ko na parang tumaba ako. And I'm so lucky to find the best, si Dr. Tess.
Women's bodies change after childbirth. It's almost impossible to get back in shape after having kids. Our Tickle Lipo procedure will get that body back.
Ladies, we can get our sexy back.
Dr. Tess, simply the best.
Hello.
Thank you very much. My favorite moisturizer.
So you have a day and a night. And this
day
is
and night. This is for Panggabi, right?
Mm-hmm.
Panggabi.
Yeah.
And this is for
the day.
The day, okay.
Yeah.
All right. I really like this product, so I'm gonna enjoy it. If I can only drink it, I'll drink it.
We'll put it all over.
Today.
All
Yeah.
over.
The neck, hands, face, put it everywhere.
I wanted to try something more natural, and when I found out about Dr. Tess, I felt immediately comfortable with her.
My husband was complimenting me and saying how young I looked, and it's nice because he's 4 years younger than I am.
The wrinkles, my skin has improved, it's tighter, it's amazing. The youthful look that I have, the freshness.
You just can't describe how it makes you feel inside. I feel good, I feel like I look good, I feel young.
The years have come off. It's a fabulous experience.
Welcome back to Gab with Dr. Tess Show. Here we are. Doc, there's a question here that's very basic. We were kids, ginagawa na to sa atin. And here's the question from Sammy Mendoza from Los Angeles. Dito,
right here.
Hometown.
Dito tayo, Sammy.
Sammy, ang tanong mo is, what is the best way to treat sunburn? Ang dami nito. Walmart, Sam's
Yes.
Club, Costco.
Very, very good question and important question. But of course, I'm a dermatologist. So sabihin ko kasi sa inyo, the best way is not to get sunburned. So iwasan, and you want to make sure you have your sunscreen, your hat.
Your cap.
Yes, sunglasses. Yes.
What kind of shades?
Kahit na ano, basta dark and big. The bigger it is, the more surface area of your face is
Walang
covered.
brand?
No, but don't forget to put sunscreen on your back, on your arms, on your legs, kasi chest, nakakalimutan kasi yung areas na yon. And then also, if you're gonna go swimming, which you like to go swimming, you want to reapply. And
How often do you reapply sunscreen? Kasi puti yun
good question. Good question.
Do you have to flood your face on it? Or
Depende ngayon, marami na ngayon different kinds of sunscreen. Meron na you can actually spray it even though you're wet. Yung iba, yung mga lotion, you have to actually dry your skin first, then you reapply. But now there is a sunscreen pill.
What is this? You pop it in, you swallow it, and
Yeah,
It acts like
is
a
a botanical, it
Whoa.
is an herbal supplement. The name is Polypodium leucotomus. This is actually one of the supplements that I discussed on the Dr. Oz show.
Oh,
And
wow.
it's a breakthrough.
I didn't see that.
Yeah.
Maybe I should watch
Yeah,
that.
you should because it's very important.
What is that? The
To watch
equivalent?
si Dr. Oz.
Dr. Oz, is that equivalent to SPF, what, 15, 30, 45, 40?
Ano, it's never been measured like that. Pero ang nangyayari is, my patients na if they know they're gonna get sunburned, depende sa kanilang activities. If they take the polypodium, they tell me they don't get sunburned. So you use it in addition to your sunscreen, the hat, the sunglasses. But once you get sunburned, if you can call your dermatologist, it's really, really good because we can really prescribe some topical, corticosteroid spray and products that can bring down that inflammation right away. It can decrease the pain, the swelling, the peeling. So if you have a friendly dermatologist near you, you can call them right away. There's second question, Gab.
Thank you for that question.
Yes,
Second
thank
question,
you,
ikaw
Gina.
naman.
Okay. All right. Kiko Castillo from Denver wrote, I'm a middle-aged man and I'm blessed with baby skin. Hey, may kilala ko ganyan. How do I maintain this look? My girlfriend says I do not need to do anything, but I know that age will come sooner or later.
Doc, I think that's the reason why, that is the reason why I am here. Even before we met each other in 1998, I was always very particular with my skin. Very sensitive ang skin ko. So I always wanted to take care of it. Pag meron ako nararamdaman o nasugatan ka o na-sunburn ka, I always put something in it. And siguro through the years, you put moisturizer. Wala pa si Dr. Tess nun. Like napag-usapan natin in the earlier episodes. Just moisturize.
Yes.
Moisturize. You don't know what the products are out there. Moisturizing is better. Any moisturizer is better than no moisturizer at all.
Totoo yan. But when you're 50 and you're blessed with good genes, you can't go wrong with good genetics. But eventually, you're right, the signs of aging will happen. But if you do maintenance and even like skincare, that will help. If you're interested in more high-tech solutions to stop the aging process, we have them. And it's possible now that every year that you're hanging out and you're alive, you can look younger, you can have better skin. I see it on my own skin, I see it on all my patients' skin. So it depends on your budget, depends on downtime mo, and it depends how fast you want to turn back the time.
If you want to see results, just come to Dr. Tez's office. You will see the staff. They're all amazing. And, they work with Dr. Tez and they get their treatments too.
Yes, that's true. And so hopefully, Kiko, fly from Denver and we'll see you here, okay? We'll turn back the clock with the time machine.
We'll see you soon.
All right. So thank you, Kiko, and for the question. And thank you po for watching. And hopefully, yung mga sagot namin can help you as well at home. And next week, Gabby and I will be back to answer more of the questions. So please send them in.
Maraming salamat sa pagsubaybay ninyo. Sasagutin namin lahat ng mga tanong ninyo sa maaari namin maisagot hanggang sa pinakamagaling namin pwede isagot. Maraming salamat sa pagtutok ninyo dito sa show namin.